Welcome and thanks for joining us. My guest today is Doug Barton, Senior Vice President, Chief Technology Officer, and Chief Engineer, Leidos Health. How are you, Doug?
Well, thank you. Good to be here.
Well, I've done a lot of interviews on Federal News Radio over the last decade, and there's very few interviews that touch millions and millions of people. And this is an interview that's really going to touch so many millions of people. We talk about defense health management system modernization, and some people call this, they call us DIMSUM, I think is what it's called.
That's right.
I'll just start off with the obvious question here. There was a previous system that made a transition. So why was a decision made to modernize the legacy MHL clinical support system?
Well, there were several reasons. Number one, the three primary systems, CHCS Alta and Accentris, acronym SOUP, had been around for decades, and it was becoming more and more burdensome to maintain those things to current clinical standards, number one. Number two, particularly subsequent to the HITECH Act and the Affordable Care Act, that had put substantial amounts of funding into the development of commercial electronic health record systems, or EHRs. And having done so, the technology in those commercial systems started to expand rapidly, and it was really creating opportunity for the department to have access to these advanced capabilities that were being built into commercial systems, and they couldn't begin to think to provide funding for a unique system of their own to keep up with that change in technology. So those were the primary two reasons.
I've worked with a lot of software developers on big-scale medical projects, mostly longitudinal studies with morbidity, mortality rates, and talk about the 4 Ps. They used to talk about this. They'd say pre-planning prevents peril. And
Right.
so what about pre-planning and making this transition? Where's that fit in?
Well, there's a number of risk items that we look at. And by the way, Leidos is a large commercial implementer of EHR systems. We're the largest third-party implementer in the U.S., and so health is health, even in the DoD, across both commercial and the DoD. It's always first and foremost clinician adoption. So you need to work with the clinical community so that they're accustomed to and willing to adopt the system that you provide first and foremost. Second, there's the question, which is in the news, frankly, about interoperability. The DoD has interoperability challenges with systems that are inside the DoD, but also 60% of their care is provided by commercial entities. And so there's, 60%. So they really have to work to interoperate clinically with commercial hospital systems and provider practices, not just with internal DoD systems. And number three, there's the issue of cybersecurity or information assurance. And while that's a challenge generally in healthcare, given the HIPAA privacy and security regulations, and the need to protect protected health information, or PHI, the DoD is somewhat more of a target because they have a fourth mission beyond access, clinical care, and cost, and that's really medical readiness. And so if you can see the health status of a large number of, soldiers, sailors, and airmen, you might be able to discern something about the medical readiness status of the units in which they participate, which is clearly a security concern. And so a higher level of care or standard of cybersecurity diligence is imposed upon the system as a result.
So we're talking about, 9.6 million DoD beneficiaries in a system that is geographically diverse and subject to more attacks than a normal medical system. And a normal medical system is subject to plenty of attacks. So this gets very difficult, doesn't it?
It's quite challenging. We've had a lot of help in a very positive way in our partnership with the DoD CIO's office to get the right security posture established for the system. The system is in multiple data centers, too, to provide continuity of operations and disaster recovery. And there's very heavy cyber protections, both provided by the hosting provider, which is Cerner Corporation, also supported by the department, the network defense provider, which is SPAWAR at the moment, also provides guidance and support to secure the system. So it gets lots and lots of attention. And frankly, that attention's warranted.
So we got a big system, a lot of risk. So what was the acquisition strategy to procure this commercial replacement for the legacy system?
Well, I think the DIMSUM acquisition departed, in some significant ways from the way they've acquired commercial systems in the past, in a very appropriate and smart way, frankly. Number one, when they laid out the system requirements against which all offerers would propose, they had very high-level statements of requirement. And what that does is multiple commercial products don't look at those requirements and say, I can't manage to those detailed requirements. My product doesn't do that, and therefore I'm not interested. So they would write broadly stated clinical requirements that relate to ambulatory health or surgery or obstetrics or oncology. And then every offerer can look at those requirements and say, my product does in fact provide that commercially, and therefore I have a path to propose in a way that's compliant. And that was really the primary acquisition strategy that they did. The other very smart thing that they did, quite frankly, was right up front, they recognized that it was going to take 18 months to procure this. It's a very rapidly moving technological environment in health. Therefore, they knew that whatever was put together during that process at the point of award would probably be a little dated. And they structured the contract to have the flexibility, post-award and frankly throughout the contract, to have the agility, contractual agility and flexibility to adjust. And that, in fact, has worked quite well during the first 2 years of the contract. So, and as we move forward in time, it also gives them the ability to take future advances in technology and integrate those into the program without a lot of contractual mechanics.
It's almost building a house and knowing it's going to take 18 months and anticipating changes in the basic elements of the house while you're building it. It's so difficult.
Exactly right. And once again, it's a little unusual, frankly, in these commercial procurements. But it was visionary, I think, on behalf of the department, and it's worked quite well. So.
We are going to pause here for a short break. My guest today is Doug Barton, Senior Vice President, Chief Technology Officer, and Chief Engineer, Leidos Health. I'm your moderator, John Gilroy, on the discussion Military Health and the Move from Legacy Systems. Sponsored by Leidos on Federal News Radio 1500 AM and federalnewsradio.com.